Tippecanoe County's Public Health Officer, Dr. Jeremy Adler, joining us now again in the studio for the latest on the county's response to the pandemic. Dr. Adler, great to see you again. That patient who passed away this morning, was that person already hospitalized with a medical condition, or was that person hospitalized because of COVID?
They were hospitalized because of COVID-19.
Okay, and how long were they in the hospital, do you know?
I believe several days.
Was that the person that was had travel history to Paris?
No, this was a different case than that one.
Okay. Have we seen in Tippecanoe County any recoveries from COVID?
Well, you know, some of our first confirmed cases in the county are approaching the point where we expect them to be recovering from the illness, and we will, of course, be monitoring those individuals closely for that recovery.
All right. Now, I know that the Tippecanoe County Commissioners are asking citizens, residents to view CDC, I think it's a CDC video about social distancing, and you asked us for airtime tonight to talk about social distancing. Can I infer that that means you don't think people are taking it seriously?
Well, I think there is some concern about that. You know, it is vitally important that all of us follow Governor Holcomb's executive order. We really need to stay at home. We need to limit our activities and travel outside of the home to just essential activities and essential travel. We need to avoid crowds. We need to practice social distancing, putting 6 feet between ourselves and other people. We need to practice meticulous hygiene.
Now, when you talk about actually putting that into practice, we've got that situation that developed today at Arconic. We've heard from today a lot of people from Arconic, as well as other large manufacturers who remain open. Does that violate the spirit of social distancing when, you know, some of these employees are saying they can't be 6 feet apart and do their jobs?
Right. Well, what we're asking, and I think what the governor is requesting, is that employers do their best to make arrangements to optimize social distancing within the workplace. I think everyone knows that it's not always possible to do so, but the more that we can do that, the lower the risk of exposure is for all of us.
All right, now you talk about all of us. Other viewers have contacted us saying they've seen large family groups grocery shopping together, and while I understand that you get a little stir crazy in the house, is that the best way to practice social distancing, or should it be one family member that goes to the grocery store?
Ideally, it should be one family member who goes to the grocery store. Keeping the kids at home, if possible, is going to be better for their overall health.
Now, you talk about kids. I personally have seen people who, I'm assuming, kids, teens, who are not family members playing basketball together while they're not in school. And again, I understand that social distancing is difficult for all of us, and it may be even worse for people in that age group. But sharing a basketball and using your time away from school in that way, is that considered social distancing?
You know, unfortunately, that would not be appropriate social distancing. And as difficult as it is for all of us who have children, this is really not the time for our children to be having play dates with other children. We really need to keep people socially distanced to protect everybody in our community. Okay,
and the bottom line here is you're talking about social distancing because it's proven to work, right?
That's correct. That's correct. When you look at countries like China, who have had good success in controlling their COVID-19 situation, it was social distancing measures and improved hygiene that really resulted in that flattening of the curve in those countries.
Okay, well, I'm sorry about your loss today, as well as the rest of the public health workers.
Thank you.
Locally. Thank you very much. Well, several people